Stable. Hello, everyone. Thank you for starting to join our meeting. So we'll wait maybe for one, maybe 2 more minutes for everyone to join, and then we'll start. Okay. Thanks everyone for joining the meeting today. I see that we have right now 81 participants, which is great, and I hope more colleagues will be joining soon. So, in order to save time, I propose we start our meeting. So, everyone, good morning, good afternoon, good evening, to everyone who's joining us across different time zones. On behalf of the Global HIV Prevention Coalition and the South-South HIV Prevention Learning Network, it is my pleasure to welcome you today to our 13th already Key Populations Community of Practice meeting. My name is Andrei Poshtaruk, and I'm a regional HIV advisor working with UNFPA. And it is a great pleasure and a privilege for me to moderate today's meeting. This virtual space continues to build a unique and vital community, a place where all of us, national governments, UN entities, implementers, donors, key population networks, all can meet and have a frank discussion and learn from each other. The importance of the work you all do should not be underestimated, and we have to make it really, really clear. Despite all collective efforts, the global decline in new HIV infections has been painfully slow. We are poised to miss the 2025 global prevention targets by a wide margin. And our strategies, now more than ever, must be targeted. The epidemic continues to disproportionately affect key populations and their sexual partners. And this is why today's meeting, which is titled Optimizing Interventions for Young Key Populations. It's not just relevant. If you ask me, it is absolutely essential if we want to turn around the current situation. So today's community of practice is designed as a peer-to-peer exchange, a space for all of us to move from policy to practical actions. Over the next hour and a half, we aim to achieve three critical objectives. And next slide, please, if we can. Yeah. So what we want to do, we want to deepen our understanding of the essential components needed for designing effective and sustainable HIV programs for young key populations. We want to explore best practice examples and program models from various settings, allowing us to learn from the real world evidence. And the third, we want to highlight the collective actions needed at all levels, be it national, regional, as well as community, to ensure that young key populations are meaningfully involved and their specific needs are addressed. Young key populations must be an absolute forefront of all of our response. Today, more than half of all new HIV infections worldwide occur among key populations and their sexual partners. And young people within these groups are particularly vulnerable. They face an intense combination of barriers. These are social stigma, intersecting vulnerabilities that they face, violence, and very often criminalization. This mix severely limits their access to youth-friendly and rights-based services. Despite explicit international guidelines emphasizing this group, young key populations remain widely underrepresented in national programs and data systems. And when they're not seen, their specific needs cannot be met, and we cannot close the prevention and treatment gaps. On top of that, we're operating in an environment marked by uncertainty regarding the future of the external donor assistance. And this is what we face these days, all of us. This challenge makes strategic planning for the sustainability of our HIV response more important than ever. So our focus on young key populations is a matter of human rights and social justice. It is our collective obligation to ensure that every young person, regardless of their status or identity, has the right to health, dignity, and a life free from violence and discrimination. And investing in primary prevention for this group is the most effective strategic task to ensure equity and achieve sustained epidemic control. To close this gap, we must shift the power. We must champion young key populations-led interventions. These tailored rights-based models, and I'm sure a lot of them will be mentioned today, bring the lived experience and expertise of the community and ensure that services are safe, accessible, and meaningful, and that resources to fund them are also guaranteed. So we have a very powerful agenda for today's meeting. We will listen to experts, and you can see, I can see it on the slide. We will listen to experts who will share global guidance, and we will also have a panel to offer real-world, scalable, and sustainable strategies. So let's use this community of practice as a safe space for a frank discussion between all of us. I want us also to start this meeting today with a commitment to leave with the concrete actionable steps to optimize our programs and secure a healthier future for all young people. So without further ado, I would like to move to the first segment of our meeting. And I have a pleasure of inviting our first speaker, Clemence Benedict, from the Global Prevention Coalition and a senior advisor at UNAIDS, to present an updated guide on planning and managing HIV programs with key populations. Clemence, the floor is all yours.
Thank you so much, Andre, for the introduction. And I will be presenting on behalf of the Global Prevention Coalition, but the work I'm presenting is actually a collaboration of the partners in the Prevention Coalition, and not just us as a secretariat. And above all, I'd like to acknowledge a colleague, Matteo Casolato from the Global Fund, who has actually prepared these slides and has been leading the process in terms of updating this, which in the Global Prevention Coalition we did with the task team on key populations within the coalition. So this really has been a collective effort. Next slide. So the document we are talking about is something that you may have seen in the past. It first came out in 2020, and it really addresses the planning dimensions for HIV programs, particularly with the prevention focus, but not only with the prevention focus, for and with key populations. And why do we need that? We need it, of course, because key populations are disproportionately affected by HIV, and there are very specific factors that often prevent access to regular health services through the mainstream health systems. And those can be social, legal, structural factors that we have presented and discussed a lot in other webinars. And the Trusted Access Platform approach really tries to bring together all the elements that are needed to ensure that access to HIV prevention, testing, treatment services, and related health services for key populations can actually be enabled. And how to do that is really the scope of this collective document, which can be used in national planning processes, but also has this specific relevance in the development of proposals to the Global Fund. Next slide. Now, how does this document relate to other documents, or how would you use it compared to other documents? So there's, of course, normative guidance, and that's what defines evidence-based norms and packages, and WHO consolidated guidelines on HIV, viral hepatitis, and STI prevention provide that kind of normative guidance, evidence of what works, and what are the packages of services for different populations for different purposes. It also works in the context of the detailed implementation tools that we have. So for each of the different main key population groups, there are actually very detailed implementation tools from the time of the early 2010s. They have not been updated, but they still provide a lot of population-specific insight. And then this particular document goes one step further in really developing and planning and budgeting scaled national programs. So this document really goes then into the how-to of running and developing a national key population response system almost. Next slide. So the Trusted Access Platform approach, what does it actually entail and describe? As mentioned, it is a service access approach. It recognizes that there's not one single channel of access, so it usually entails a combination of different access points. And we refer to it as a platform. We discussed a lot on what the term should be, but we refer to it as a platform because it entails, could entail physical sites, it could entail outreach, but it could even be happening in the virtual space. And some interventions are actually structural to enable access. And all those different elements entail a combination of different platforms or points or modalities to ensure that there is actually trust in the services and that they can be accessed. And also, I think one background to this, if we look at back in 2020, why we decided this, there was a lot of key population programming work happening for specific tools or very specific purposes. So we might have had a key population demand program for PrEP, or an outreach for self-testing or testing for key populations to refer people to treatment. And the purpose of this guidance also is to think beyond that and say, what is the optimal mix of modalities of access points for providing a mix of services to key populations. So also to go beyond this fragmentation. Next slide. So what is covered in the guidance? The guidance covers, first of all, in the first part, how to build trusted access platforms. So understanding the concepts, key elements, planning and adapting, and then guidance on cost benchmarking, outreach roles, and responsibilities. The second part now is looking more at the planning and management. So that has a little bit more macro level information also on mapping and population size estimates, conducting effective oversight and monitoring, community-led monitoring being embedded, and strengthening capacity and leadership elements as well. And then bringing in that sustainability perspective. So if you take it in a nutshell, the first part is more for local level implementers and managers on the ground. The second is more for national level, the strategic decision makers, which should, of course, also include key populations themselves. Next slide. So the key elements of a trusted access platform are, of course, a combination of modalities, as I already said before. So this slide just introduces typical elements of a trusted access platform system. So it could be pharmacies, health facilities in terms of venue-based interventions with a health focus, but could also be community safe spaces, outreach, vending machines that are typically part of this. And the combination will really be context specific and depending on the population, on the country, often on the policy environment. In some cases, certain elements of services can be provided through the mainstream health system. In other settings, that is not possible. And of course, for young key populations, there will need to be specific considerations and maybe a mix that is tailored to the needs of young key populations. Next slide. So the factors that I was already starting to allude to that will inform the combination that will be suitable for country context might include epidemiological considerations. For example, size of the population. In a city, do we have thousands of people or maybe a few hundred or a few dozen only? That will, for example, be important to consider on whether, there might just be temporary outreach sometimes, or there might be a more stable, larger population that will utilize something like a drop-in center. So those could be considerations. Knowledge of the local context, so really where should it be located for key populations, including young key populations, to access the human rights environment. Level of resources available is, of course, always important to consider. Can we actually replicate what we're trying to do in all the settings that need it? And then, variations with different key populations, subpopulations, including, sometimes migrants, mobile populations. So if we look at the design, and this is really already the last slide I have, is the next slide. We have then also, to make prioritization considerations. And the way this is presented here is with fewer available resources, we can do fewer things, and with more available resources, we can do more. So you have a combination of different elements, and based on resourceability, one would add additional elements. So there's some elements here at the bottom that cut across that should probably be available in all settings, and that might not necessarily require a lot of resources, but could be done within existing systems. So those are enabling legal and policy changes, community engagement, but also key population competent health facilities and competent pharmacies. So that could be achieved even by integrating these skills, these capacities into regular health system training. And then building on that, of course, with limited resources available, one could start peer-led outreach, perhaps virtual spaces. It might be cheaper and easier to do, but then one could build on top of that peer-led outreach in physical settings as really the starting point of a dedicated key population programming platform. And then add additional service modalities, online services, again, probably the most scalable and lowest cost, but also vending machine, co-located service models with some dedicated service delivery stream for key populations, and drop-in centers and clinic sites or mobile clinics, probably the most expensive modalities. So, and the idea is that if you then click again, that you gradually add the more resources are available to actually provide these services. And the same would, of course, also not just have a resource consideration, but also an HIV incidence and vulnerability consideration. So within populations, you wouldn't just, in a country do the same for everyone, but you would also try to ensure that those more intensive interventions at the top right corner would reach the people who are most vulnerable, including young key populations, and have highest HIV incidence. So there could again be a differentiated planning here to ensure that the services reach those who most need them. There's much more in this guidance, but I leave it at this and hand back to Andre.
Thank you. Thank you very much, Clemens, for sharing with us this new and very important for our work guidance focused on addressing the needs of key populations. It was great actually to see the differentiated approaches tailored to different financial scenarios, very important, especially these days. And I think we all look forward of reading through the document once it's published. And I will get back to that at the end of the meeting too. So again, thank you. Our next speaker, I'm very excited, is Maria Stacy from the South-South HIV Prevention Learning Network. She will be presenting another critical document, a new guide on how to implement programs for young women who sell sex. Maria is an independent consultant from South Africa with the background in key population program management, including sex worker organization SWET and Global Fund PR NACOSA. Maria specializes in HIV, sexual and reproductive health and rights, human rights and equity, gender and community-led responses. Her work encompasses research, consultation and facilitation, advocacy, and organizational strengthening. She also provides strategic guidance to the African Sex Worker Alliance and national-level key population-led organizations in sub-Saharan Africa. So, Maria, the floor is yours.
Thank you very much, Andre, for that introduction. And thank you, Clemens, for your presentation, especially the last slide around the prioritization considerations. I think that's really important in the current context. And this presentation kind of leads on and picks up on those issues. First of all, I just want to say hello to everybody who's on the call from wherever you are. I see some familiar names in the chat, so really thank you for joining. And I want to say, as you mentioned, Andre, that I do come from a key population and especially as a sex worker implementation background. And this issue of young women who sell sex is something that we in the programs have been discussing for a long time. And, for a long time identified that it's been a gap. So I was very happy to be invited to by SSLN to develop these implementation guidelines. So having introduced myself, I'm going to switch off my video and we can continue. So yes, thanks for the opportunity to present the implementation guide for programs with young women who sell sex, or YWSS for short. And this resource is designed for implementers, for donors, community partners who are working to ensure that no one is left behind in the HIV response. YWSS are amongst the most vulnerable, yet the least visible and the most marginalized populations, especially in sub-Saharan Africa's HIV landscape. So I'm going to take you through the guidelines today and explain why they're so urgent and so relevant now, and how we can adapt our existing programs to ethically reach YWSS. So these guidelines follow on from another SSLN tool, the Insight to Implementation Evidence Brief, on how can we reach and provide HIV prevention programming for young women who sell sex. And after SSLN developed this evidence brief, there was a call from the people who read it to have more details, especially practical guidance on how to identify, reach, and support YWSS using existing HIV and SRH infrastructure. So as I've said before, the focus is on adaptation, integration, and rights-based service delivery, not necessarily the luxury that we have at the moment, that we don't have at the moment, of standalone programs. And yeah, the graphic just shows that, you know, we have sex worker programs, we have AGYW programs, and a lot of the time, both the sex worker programs and the AGYW programs are not adequately meeting or reaching young women who sell sex. Maybe they don't identify as sex workers, and so they're not reached by sex worker programs. Maybe they're under the age of 18 and they're selling sex. And there's a whole lot of barriers, which we're going to come to in the slides that are upcoming. Or maybe AGYW programs are not managing to reach the AGYW who are at the highest risk. So for various reasons, this group has historically been underserved. So let's move on to the next slide. So why is this work critical now, especially when we're having the funding crisis, especially the US government donor cuts, which are threatening all key and vulnerable population services? And the reason I would argue is that it's even more necessary now than ever before that we do precision targeting and identify which interventions are going to have the highest epidemiological impact per dollar. And as I've said before, we actually lack quite a lot of data, although the data is growing and emerging, on incidence rates amongst YWSS, which show that they are, you know, one of the highest risk, highest incidence populations for HIV incidence. So the guide is promoting adapting existing AGYW and female sex worker programs, not creating new ones. And as Clemens showed in his slide on prioritization, community-led approaches are cost-efficient and yield the highest reach. So it really is one of the most strategic approaches to include community-led responses when you're reaching young women who sell sex. Next slide, please. So who are young women who sell sex? How do we define them? It's very important to stress that it is around consensual sexual exchange. And we can think of sexual exchange as a continuum. And on the one end of the continuum, you have sexual exploitation and trafficking. We're not talking about that population. And on the other end, we have intimate partner relationships. And the group that we're talking about falls in the middle on this continuum. So it includes sex workers, it includes adolescent girls and young women who are, you know, anyway vulnerable, especially in sub-Saharan Africa. And it includes the phenomenon of transactional sex, which, you know, is exchange of sex for material support. Although it's important to make a point that transactional sex is not just about survival. It can be in some contexts, but it really varies from context to context. Sometimes it's about supporting one's aspirations. And sometimes it's around peer pressure and social norms which normalize transactional sex. And in the sex work sector, we often used to say that, you know, all sex is by its nature has some kind of transaction involved. So transactional sex is very common, especially in our context. But the boundaries between these three overlapping groups are fluid. You know, where the one ends and the other one begins is, you know, there can be some debate. You know, even someone who identifies as a sex worker, if you ask her about her practices, you may think that sounds more to me like transactional sex. And if you speak to a young woman who's engaged in transactional sex, you may also think, that, you know, to me sounds like it could be sex work. So, you know, I think we know from experience that drawing a line between these different categories is often quite difficult. And also that people can move between the different categories at different stages in time, or they also can fall into both categories at the same time. But we do know that, and these definitional debates are one of the reasons why WSS have been left behind. In terms of age, this is can be quite a controversial question, and the definitions vary by country. So in the guidelines, we don't prescribe what ages YWSS are. Kenya defines them as 15 to 24, but other countries may want to define a young woman who sells sex as 18 to 24 because of certain regulatory issues which they have, which we'll come to just now. Next slide, please. So why have young women who sell sex been underserved? A variety of reasons limit their access, and especially when it comes to minors. So the one is the criminalisation of sex work. The other one is age of consent laws for accessing treatment and age of consent laws for sex, which vary from country to country, especially in sub-Saharan Africa. The mandatory reporting barrier I'm going to come to just now. Then there's stigma, obviously, around selling sex. There's moral judgment. There's a lack of youth competent services, non-judgmental services. There's rigid program silos, which exclude those who don't fit, as I've just mentioned. And then there's poverty, there's mobility, there's gender-based violence. I think we can also add substance abuse to the mix, high-risk behaviors. And also the fact that often, you know, they're adolescents and young people, and they are, they maybe don't, there's a lack of knowledge, but also there's a lack of accurate risk perception. So a lot of times when you talk about YWSS, people raise the issue of minors who sell sex, people under the age of 18 who are selling sex. Now, these exist in every context, but often in some contexts, there are mandatory reporting requirements. So my implementation experience is in South Africa, and in South Africa, we were always required to report minors selling sex, either to social services or to the police, which was not always the most effective response, and sometimes deterred minors selling sex from even accessing services in the first place and drove them further underground. So the Convention for the Rights of the Child requires us to act in the child's best interests, to protect them and not to punish them. And so the way some countries have responded to this dilemma is to recognize young women who sell sex, and specifically minors selling sex, as mature or emancipated minors who can consent to SRH care. Next slide, please.
Can you please try to wrap up with the next couple of minutes? Thank you. Okay, will do. So this is what the beautiful guideline looks like. This is the content of the guideline: mapping and digital outreach strategies, service design and planning guidance, ethical decision-making for healthcare workers,
guidance on meaningful participation, community mobilization, and leadership development for young women who sell sex, costing and sustainability considerations. And I want to highlight that these interventions need not be very expensive. Kenya has done a costing study and found that there are very that the additional costs are not very huge. There's monitoring and evaluation considerations, including CLM, and case studies and templates for immediate use. Next slide, please. Two quick case studies. This is the second last slide. So this is two real-world examples of how two different countries have adapted their programs in different ways. So in Kenya, the sex worker program was adapted. They consulted with YWSS, they engaged them in the design, they went and mapped the sites to identify locations where young women who sell sex congregate. The drop-in center for adult sex workers was expanded to serve YWSS age 15 to 24. YWSS peers or near peers were introduced, trained, and conducted micro-planning. Healthcare workers were trained around the specific needs of YWSS, and the shared staff and facilities kept the costs low. And the result was higher HIV knowledge, more clinic visits, higher PrEP uptake, and improved linkage to care. So Zimbabwe took a different approach and they adapted their DREAMS program. So they came at it from the AGYW program. They noticed that AGYW were engaged in transactional sex and that they were not that willing to engage in the program. So they reached out to them specifically with peer educators, linking them to HIV, GBV, and social protection. They developed a manual, and I encourage you to look at the manual because it's super. Interactive group sessions conducted for YWSS. Again, mature minor consent allowed them confidential access. And the result was increased access and retention for what had previously been hidden subgroups. Last one, I think. Next slide. Yes. So in conclusion, reaching YWSS is an issue of equity, efficiency, and ethics. And if we have a precision focus, we maximize impact where the incidence is highest. It's important to have community-led, data-driven adaptation of the existing programs. And just to say that the implementation guidelines will very soon, probably next week, be available on the SSLN I2I website. There's the link. And I want us all to think about what practical steps could existing AGYW or sex worker programs in your countries take to identify and include young women who sell sex. Thank you, everybody. Thank you, Andre.
Thank you. Thank you very much, Maria. Thanks for sharing this guidance, new guidance that draws particular on examples from national countries and how programs for female sex workers, adolescent girls, and young women can meaningfully include this group. I think it is a critical document ensuring that indeed no one is left behind. So again, thanks so much for sharing, and great to know that it will soon be available for download at your website. We are running a little bit late on time, so I will right now jump into our next section of our meeting, and I want all of us to move to our panel session. And our panel session for today will have a number of very exciting guest speakers representing national government, key populations community networks, and donor organizations who will share their practical strategies and best practices for developing and implementing scalable, sustainable service delivery models for young key populations. There will also be a possibility for you to ask questions to the panelists, and you can do it directly by posting to the Q&A section in the Zoom. And I would ask colleagues from the network to monitor that. When you post the question, please also try to identify who this question is intended for. Before I start, can I please ask colleagues to let me know if Dr. John Bao is connected?
Yeah, I mean,
Oh, thank you so much. Okay, great. This is very great. So our first panelist is Dr. John Bao from the Ministry of Health of Kenya, representing National AIDS and STI Control Program. John Bao is a dedicated public health specialist with extensive experience in HIV prevention, care, and treatment, particularly for key and vulnerable populations. With over 40 years of hands-on experience in community engagement and program management, he has worked to expand equitable access to HIV services for marginalized groups, including people who inject drugs, men who have sex with men, female sex workers, transgender communities, and truckers. His work reflects a strong commitment to strengthening Kenya's national HIV response and advancing inclusive public health systems. So, Dr. Bao, question to you. Can you please share with us how is your country ensuring that young key populations are prioritized within the national HIV response? The floor is yours.
good morning, good afternoon. John Bao is my name. I work as the Key and Vulnerable Populations Manager in MOH, Ministry of Health, Kenya, and NASCOP. So really, I really appreciate the opportunity. And in the area of reducing funding, which happened, I think, to most of the countries this year, then it was noted that there was an imbalance. The need was there to continue programming and ensure that young key populations get services. But the funding, of course, as all of us know that with the stop-work order, most of the activities, community level activities were stopped. And hence the gap in terms of implementation of interventions. So as a country, when that came up, noticing that we had already done our IBBS, which had shown that key populations continue to be disproportionately affected by HIV infections and STIs as well. We conducted an assessment just to look at how the programs were affected, the service disruptions, and areas where key populations were unable to access services. And out of that, we, as a country, stakeholders were able to meet and agree on those models that are sustainable with reduced funding. One of them being ensuring that for areas that we had physical sites that didn't have support, that then there were continuation of the outreaches that we used to do. Of course, ensuring that we're able to continue with the community outreaches in those hotspots that then the Yankee populations congregate and ensure that they're able to get services. Also, there are some sites that we were able to integrate and be able to ensure that we moved the sites with the reduction or the pull out of funding into government facilities, just ensuring that we have safe spaces within the government facilities where these young key populations can be able to safely be able to access services in those designated safe spaces. We, as a country, in the process of developing a transition guideline, because then we realized that when donors and partners pull out, then communities are left without any help in terms of where to access services, and really the confusion that comes out with that. And as a country, stakeholders were able to agree on doing an transition, sort of an SOP that communicates on to how services should be rendered, and in the time that a partner pulls out, then how we are able to ensure that services continue, really focusing on how services should continue without funding the community level. We conducted most of the partners were supporting HRH. And of course, with the pullout, the gap in terms of HRH was eminent, and we were able to support counties and service delivery points with ensuring that the government then deploys healthcare workers to be able to attend to key populations, and then capacity builded these healthcare workers through trainings and sensitizations to ensure that being new in the program, then they're able to offer stigma-free services. While doing that, we adhere to the young key populations guideline as highlighted earlier, which has been guiding the implementation of services, ensuring that really the package of care is delivered within the available strategies that have been agreed on. Not forgetting that as a country, we also have adopted the online peer education, the peer education, or sort of the behavioral interventions that can be offered via an online model, really adopting that and ensuring that those service delivery points, the clinics, the CSOs are able to, and the peers are able to attend to the young key populations via an online model. I think that is a match that we have been able to cover as a country to ensure that there are no service disruptions. And back to you on the questions asked.
Thank you very much, Dr. Mbao, for your insights and also for sharing your country's experience and success in prioritizing young key populations within your national HIV response, especially in times of reduced funding. And I think it's also great to see how Kenya is creating and supporting that enabling environment for partners and donors to come together and to design and implement programs for and with young key populations. Thank you very much. Now, we will have an opportunity to hear from our community networks. And I have a pleasure right now of introducing Ika Novianti from Indonesia, who's the regional coordinator at Youth Lead, the largest network of young key populations in Asia and the Pacific. Ika also represents young key populations in Asia and the Pacific as a Youth Council member of the Global Fund. So question to Ika, what priorities should government and donors consider when designing, implementing, and funding programs with young key populations? So the floor is yours, and you will have maximum 10 minutes to address that. Thank you.
Thank you so much, Andre. Good afternoon, everyone. I will try to manage to cover all of my talking point, not beyond 10 minutes. So in my perspective, government and donors must prioritize youth-led and community-driven approach as a central pillars of young key population programming. This means investing program designed, implemented, and monitored by young key population themselves, not just for them. So despite the progress, young key population continue to face major programming gaps, particularly in integrated SRHR, HIV, mental health services, legal literacy, and sustainable funding for youth network. From youth-led experience across, we working across 20 countries in Asia and the Pacific. I think there are three main priorities that the government and donors should really focus on when working with the young key population. First is invest in youth leadership and capacity. Too often, young key population are still seen as beneficiary rather than equal partners. When government and donors intentionally support young key population network to develop leadership and technical skill, we see those real change. For example, through the Global Fund and also Learning Hub, Youth Lead has trained young advocates to engage in the country dialogues, contribute to community-led monitoring, and even take up seats in national CCM. So this kind of investment ensures that we can move from token consultation to the decision-making roles. Second, support integrated and youth-friendly service delivery. As all of us know that Yankee population experience overlapping challenge, HIV risk, gender-based violence, mental health concern, and limited access to SRHR services to age of concern, and etc. So this program must therefore be holistic, inclusive, and stigma-free. And the third one is ensuring direct and flexible funding for youth-led organization. Even when youth are recognized, funding rarely reaches to us directly. So youth-led group often struggle accessing donor fund due to complex requirement, and also through the, as youth lead, we have the small grant mechanism that support the youth-led organization. And we've seen how the direct support empowers young people to innovative, quickly monitor service and hold system accountable. So in short, if government and donors want programs that truly deliver result, they must invest not just in service for Yankee population, but in the power, leadership, and innovation of Yankee population themselves. Over to you, Andre.
Thank you very much for your inputs and for being very on time and succinct. Very much appreciated. Indeed, it was great learning from your experience and for you to present the perspective of the communities, listening to the community voices and ensuring full and meaningful youth engagement, especially when it comes to Yankee populations in all of our responses is critical if we really want to affect the change. Thank you again. Our next speaker and the panelist also represents voices of the community. We have a pleasure of having Henry Akiwu from Youth Rise, an organization that mobilizes youth for engagement in full spectrum harm reduction and drug policy reform to promote health and human rights. So, similar question to you, Henry, as to our previous speaker, and also in case you can elaborate, how can Yankee populations be meaningfully involved in decision-making, governments, or program implementation? You can also share that with us, and if you have any good examples of what actually worked. The floor is yours.
All right. Thank you for the opportunity. I will go straight to the question. For me, based on the fact that I work, my work has transitioned from the community level programming to a point where I'm working at national level, at the working within the policy, legal, and advocacy space. If you ask me, we need to, it's important that we address those issues that make this population vulnerable in the first place. Because if the issues that continue to make them vulnerable are not addressed, then that means whatever intervention that we are bringing in will not yield the right result. So and what are these issues? These issues has what we call a cause and effect on young key population, and there is need for us to address it. You may ask, what am I really saying? In the first I'm working in Nigeria and even within the West Africa, and having interacted from young people across different regions. One thing that is one common denominator within the space we work is criminalization. If governments across the globe continue to criminalize young key population, then that means that's a fundamental problem, and this is a common denominator. And when you look at criminalization as a challenge, it has multiple effects, and that borders on the health of young key population. It has social effects. It has even economic effects. So criminalization comes with law enforcement. And what does law enforcement do? You know, when you do law enforcement, it drives this community underground, and they cannot have access to service. So having access to service, for me, I may consider it as a secondary, but there are some fundamental issues that need to be addressed for this young key population. If they are being criminalized, then that means we know what we know how many years of intervention that we put into the different country national response even for the community to start to have a voice and being involved in decision making. So what the previous speaker has highlighted the need for them to be to be recognized and also to be on the table where decisions are being made. And for different countries too, we know the challenges, even at current challenges in terms of being on the table when decisions are made. If the government across the nation does not, the law criminalizes key population, then that means they will not be at those governments space where those decisions are made. For example, in the parliament, if the law of the land criminalizes, key population practices, then young key population may find it difficult, in standing up for their rights in the parliaments of those countries that criminalizes young key population. And for example, in Nigeria now, we are working towards harm reduction, for example. There are many countries across the world that have started this tailored and program meant to address the harm and associated with drug use, and also providing services for young key population. For example, in Nigeria now and some other countries, they are intervening in this space for many years, and donors, and in those countries funding had been coming from donor. Like in Nigeria, donor account for more than 90% of the funding. And if the law criminalizes people who use drug, then that means that there is no legal framework backing up harm reduction in those countries. Meaning that if any government, a transition from one government to another, a new government can come with a policy, that will make us, come with a contrary policy or law, then that means all the investments we've had in various countries for over 10, 15 years, will be banned. And we've seen some countries in East Africa where some of the gains that were made in the program, because there's no legal backup for such program. And if there's no legal framework for such program, then that means there will not be funding, there will not be appropriation, there will not be budgeting for young key population program in those countries. And we're in an era where everybody is talking about resource domestic funding. And these are critical issues facing domestic funding in most countries, because if there is no legal framework, if there's no law backing up some of this program, then that means governments will find it difficult in funding such program. So I can, so I'm looking at it from this perspective. I think the other speakers talk about the need for, for inclusion, young key population being involved in decision making and all of that. But this is another perspective through which we can look at it. And of course, community engagement is quite critical. And if government has policies and some of those policies are not, national strategic plan for HIV, national strategic framework for HIV, and there is no law, backing up such program that will transform into allocation, appropriation, and budgetary support for such program, the issue of sustainability of such program will continue to be a challenge in those countries. So I can go on and on, but I don't want to, reinvent or sell what has been said in terms of capacity building and decision making, and in terms of model for service delivery, and the need to have youth-friendly service and all of that. So this is the perspective I've decided to look at it, not reinventing the wheel. Thank you.
Thank you again, Henry, for your insights. Thank you for focusing on vulnerabilities and on challenges the young key populations face, especially when you talked about criminalizations and other factors that affect the access. And also, thanks for touching on the meaningful engagement of young key populations that goes beyond tokenism. I mean, meaningful is the key word here, I think. And this is something that we should never forget or compromise when it comes to designing, implementing, and then evaluating our response programs for young key populations. Okay, so we have one more panelist for our today's panel session, and I have a pleasure of introducing Matteo Casalado, who is with us today here from the Global Fund, who will reflect on the donor perspective. I mean, we've heard from the government, we've heard from the civil society, and I think it would be very important and useful for all of us to hear the perspective of the donor. So, question to you, Matteo. Considering the funding challenges happening globally, how is the Global Fund ensuring that young key populations remain a priority? The floor is yours.
Thank you, Andre, and I hope I'm audible and you can see me well. I turned on the camera. If my internet connection is not good enough, please advise. I can turn it off. I'm a bit unsure of it. Well, but first of all, let me thank this is Helen. Thank you and everyone for inviting the Global Fund to this panel. It's really a pleasure to be here with you today, and also great to see so many colleagues and friends connected today. Maybe coming to the question. Well, first of all, I'd like to say that even in the current situation, we're calling it a funding crisis, right? Young key populations are and remain a big priority for us. Maybe just a point on also when we talk about key populations, at least one of the efforts that we're trying to make is trying to really consider that this group of people in the most comprehensive possible way. I'd like to say, adolescence is really a time of rapid change when maybe labels, tags, categories might feel a bit tight. And so really we're trying to also, when we make these investments, to try and really acknowledge this period of change, and then always people are free to identify in different ways, and also acknowledging that their needs might change over time. So important really to try and consider that. And I just want to say that at the very beginning before starting. Now, in terms of what we're doing and how we intend to move forward, maybe let me start with what we're doing, and then we can maybe look at a bit of the future. So in terms of what we're doing, 3 big priorities, and I think Ika touched on some of those as well, right? So we're looking at increasing access to services for young population. What does this mean? This means specifically provision of health services, prevention services, testing services, access to treatment. And how do we do this? Obviously, when you think about community service delivery, we look at peer-to-peer models where a young key population reaches out to young key populations, ensuring that as much as possible we match peer with the right type of peers when they provide services. But not just, as I said, provision of services, also working around the enabling environment, on the lowering some of those barriers that also Henry was touching on, that prevent people, young populations, from being able to access services. So, for instance, I won't mention again, but laws that criminalize populations are a big barrier when it comes to being able to go there. Also, helping and supporting young people to deal with internalized stigma is a big and important thing that we're looking at, and dealing with those sometimes mental health issues that stop us from accessing services. Also lowering the age of consent, for instance, to access services, and maybe when it comes to particularly to young populations who are women working to change and have better gender norms, right? So that we can also make sure that we work on that side. So this is more around in terms of priority number one in terms of accessing services. Another important one is youth engagement, engaging young populations in all the processes that concern the investments that the Global Fund make. And I want to start with one that Ika, of course, knows very well. It's the Youth Council. It's been created in 2020. It's an advisory body to the executive director of the Global Fund, and it's really working to ensure that we bring the voices and the needs of young people all the way up to the executive director, and really in those spaces where decisions are being taken around investments and around priorities in the HIV response, but not only also in the TB and malaria one, obviously. Then when it comes to the strategic initiative around community engagement, and we have so many colleagues here, there are a number of initiatives that we are experiences that we are investing on. When I look at for instance, the long-term technical assistance that we provide as part of the community engagement strategic initiative, well, there are a lot of partners here, but to name a few, there's the Youth Organization for Drug Addiction, obviously the important collaboration with Y+, the global network of young people living with HIV, the Asia Pacific network of young populations, again, an important partner in ensuring that more and more we can work to engage young people in the young populations in the HIV response, but also as individuals, as advocates, but also as part of organizations, right? And there's also another important, piece of work that is done to make sure that smaller organizations that are youth-led more and more have the capacity and the skills to become implementers of the Global Fund. But I can touch that maybe on another occasion because that's a whole big chapter of work. Another one, and maybe I'll stop here with the last thing, another third and maybe last priority, it's really working on building the capacity of and the leadership of young key populations. I just want to touch, for instance, on the Her Voice Fund, an important initiative that is co-funded by the Global Fund together with Viv Healthcare, that is entirely managed by Y+, that is really providing doing a lot of work to ensure that we create the leaders of tomorrow when it comes to the HIV response. Also, that also obviously looks at young key populations, people from key populations themselves. And I don't know, I don't want to speak too much. I'll stop here, but happy to take any questions in case. Thank you.
Thank you very much, Matteo. And yes, colleagues, please, as I mentioned, if you have any questions, please post them in the chat so we can take a look at them. But thanks again for very insightful and useful input. As we all know, availability of continued funding is of an utmost importance, especially in the area of shrinking international funding. And it is great to see that the Global Fund continues to support HIV response and that it actually very much prioritizes most at risk and those further behind groups such as young key populations. And thank you very much also for highlighting some of the concrete examples of effective partnerships with young key populations networks. That was very much appreciated and very, I think, inspiring for all of us. Okay, so colleagues, I think we're slowly moving towards the end of our meeting. We had a marvelous session just now with great presenters. And please, if you have questions, post them. So we still have some time to ask specific questions, or maybe they can be also addressed online. Again, I want to thank all of our great panelists for the insight and their shared experience. And now I want to pass the floor to my colleagues from the South-South Learning Network to take us through the Mentimeter exercise very quickly, around 5-10 minutes, to reflect on takeaways from today's discussion. So colleagues, the floor is yours, please. Okay, so yeah, let me continue. So you will basically, yeah, you see basically in the chat, there's a link to Mentimeter, and you see the question. There's only one question, and that one question is, what is one takeaway from today's discussion that you would like to prioritize in your country or organization's work? So let's give it a couple of minutes. Please go using the link that was posted in the chat and provide your inputs. Yeah, let's have a couple of minutes for that. Okay, colleagues, if you have problems accessing, just put it in the chat, but I think it should be straightforward. Yeah, we also have a QR code that you can use. And we can already see in real time some of the answers, of course, anonymous. So please, colleagues, be active. I think this is very important and very exciting, if you ask me. Okay, we're getting more responses. That's great. I will give it 2 more minutes. One more minute. Okay, colleagues. So I think you can all see the shared screen, and you see as the answers appear and as colleagues provide their inputs. And there's lots of actually very common things that people talk about. There's also some things that we can take forward with us as we move on. I think this could also be very important for us for our next steps as we think about what we will be doing after this webinar. I think those of you who thought about one key thing, maybe you can use it as a starting point after, tomorrow when you start working on the all of these great things that we discussed today. I hope they will help you in the future. Um, we are moving towards the end of our webinar. So I think it's been truly engaging and focused when it comes to any community of practice meetings. I think this one was particularly interesting. Not because of the topic, but of course, for me, it's a passionate topic. Young key populations has always been something very close to my heart. Um, we came together here today to discuss this critical area, right, of HIV response, interventions for young key populations. All the discussions we had today, starting from presentations of the global guidance, documents, to the incredibly rich panel session that we had. All of them, I think, underscored one essential truth. If we are to meet the global targets and sustain epidemic control, we must address the specific and intersecting vulnerabilities faced by young key populations. And that must be done at different levels. Our discussions today, especially the panel session, highlighted some critical takeaways that I would like to highlight for all of us. First, tailored and rights-based interventions are essential. They are essential indeed. The challenges of stigma, criminalisation that was mentioned, violence, and limited access to youth-friendly services, they all demand interventions that are specifically tailored, rights-based, and crucially, young key populations led. And I think we witnessed some of those things today when we had panelists from our communities talking to us. Second, that I think needs to be mentioned here is that practical success models and practical stories, they do exist around us. We saw today that despite challenges, including the uncertainty of future donor assistance, countries are implementing HIV service delivery models. Some of them are fully or partially integrated with key population or adolescent and young people programs. But they do exist, and there's so many of them around us. And the third one, the last but not least, sustainability is actually non-negotiable. And this is something that I keep talking about. With planning for the HIV responses, sustainability being more important than ever, we must ensure that any program we design, fund, and implement is both sustainable and scalable. And as for the commitments, when I was looking at the responses that you all put in the Mentimeter, I have an idea. So let's have this as a takeaway. Whatever you prioritized in the Mentimeter, that single action you wish to drive forward in your organization or country, let be that starting point for you to work tomorrow. And I also have, as I mentioned at the beginning of our meeting, two short announcements for you. So the first one is, please look out for the upcoming release of the guidance that was presented at the beginning, the planning and managing HIV priorities with key populations. This will be essential resource for all of your teams and all of your organizations, and it will be available on the Global Prevention Coalition website, and we'll try to make sure that you're notified as soon as it is published. And the second announcement relates to your feedback. Your feedback is crucial for the ongoing success of this community of practice. In the coming weeks, we'll be contacting everyone who attended our community of practice meetings, both in 2024 and also this year in 2025, to solicit your feedback. We need your recommendations to help us determine the priority themes and overall direction we want to take for the next year, for 2026. So please take some time to share your insights when you receive the request from us. As we close, I want to thank our hosts, the Global Prevention Coalition, the network, our presenters, panelists, and each one of you who are here with us today for all your dedication, for your passion and expertise. So let's ensure that young key populations are not just included in our response, but are actually active agents, and that are the ones who are leading towards the sustainability and change. So thank you very much, everyone, and I look forward to connecting with you in the future.